Health News is brought to you by Dynamic Physical Therapy. Call us today to set up a free 15-minute screening with a physical therapist.
Vertigo can be a very unpleasant experience, and it can also lead to more serious issues like accidents and falls. Terri, Hamp of Dynamic Physical Therapy says there are usually specific events that lead to the inner ear problems associated with vertigo.
Sometimes when it involves that inner ear and those crystals not being in the right place, what happens is maybe they've had a fall and they've hit their head, or they were in a motor vehicle accident, or they slipped on the ice and fell. But also there can be things where it's just there's no good reason. It just comes on one day, they sit up, and there it is.
Vertigo symptoms are usually pretty clear, and therapists say there are certain signals that people should keep in mind as potential warning signs.
So some of the symptoms are, if it gets very severe, you'll be nauseous. Sometimes if it gets too severe, you will have vomiting. A lot of times it will be the room is spinning. You turn a certain way typically, or you look up, you look down, you turn side to side in bed, a lot of people will say, and the room spins. They can't tell if they're up or down. Those are a lot of the common symptoms that we'll hear.
For people who have significant dizziness or other indications of vertigo, a checkup with your general practice physician is usually the first step in solving the problem.
The first step, I think, would be to go and see their physician, review their medication, if anything has changed. Another thing that sometimes can be affected, that I see this with a variety of age groups, but a lot of times that older population, is vision changes.
After a physician has checked for apparent problems such as drug interactions, a visit to a physical therapist like Terri is often the next part of addressing vertigo.
The first thing if you come into the clinic is that we will test to see if it is something within your inner ear that we can treat. And we do that with some specific movement tests, and we look at your eyes to see the movement in your eyes to see if that's something that is a positive sign for us to be able to treat, and then we can do certain maneuvers and positionings to try to reposition those crystals.
And experts say there's good news if you or a loved one does experience vertigo problems. With the right professional help, this health issue can often be fully corrected in a fairly short amount of time.